I love babies. I love that they're all so different, yet they're all so similar. They're all cute and adorable and fluffy. I love being able to snuggle them. I love being able to tell my patients how to make them better when they're crying. I love that part of my job. And being a labor and delivery nurse especially is amazing. It's so gratifying.
We really focus on family-centered maternity care. So it's really centered around them and how they want to base their care, what they want to learn about their baby.
Families really like that. They like the atmosphere that this hospital provides. We have board-certified obstetrician gynecologists, board-certified maternal fetal medicine specialists, exemplary nursing staff. The suites is state-of-the-art.
Having a baby is a huge event for women. No matter if they've had 1 baby, 5 babies, 8 babies, every birth is a huge event. And making that special for them is what we focus on. We offer soaking tubs for hydrotherapy in labor. We have telemetry monitors, and it gives her the ability to leave her room and walk around in labor. We have nitrous oxide, which you breathe through the mouth and nose. It's all controlled by mom. We really support women in their choice in labor. We're educating you, having you make informed decisions, and supporting you in whatever those decisions are.
We always try and anticipate what the needs might be before delivery, but as we all know, sometimes unexpected things occur. So it's important for families to know that we can provide the full complement of necessary care for a sick newborn baby at the Meridian facility at any time.
Should anything happen, even if it should be minor, the NICU is right next to the labor and delivery postpartum beds, so that should there be a problem, you have that ability to bond with your baby, to do skin to skin throughout the day, to breastfeed the child, and have that chance to do the initial bonding that you wouldn't get should you be separated from your baby. And that's very important both for the children and the mom.
We're a 24-hour facility, so if you have an emergency, I've got your doctor on speed dial. I've got a laborist on speed dial, which is the doctor that's here all the time. So we've got who we need when we need them all the time.
Once they're done with labor and delivery, they come to a different room, nice and clean. We have a pull-out bed for dads or significant others to have their own little space.
I would definitely encourage people to bring whatever makes them feel comfortable. We have patients all the time bring in their favorite pillow or their nice fluffy robe or their favorite pair of slippers. If you have something that is really important to your comfort, bring it.
We do baths, labs, hearing screens, pretty much all their tests right in the room with them.
We've got all the things that your baby will need right there in the room at delivery, so your baby doesn't have to go far, just to the foot of the bed. Family bonding time here at Meridian Maternity is very exciting and very important.
It's 2 hours during the afternoon that there's no interruptions. The unit is completely quiet, the lights are lowered.
It's really just an opportunity for you, your significant other, and your baby to get some much needed R&R. It helps them achieve that intense bond with their parents. It gives them time for skin to skin and work on breastfeeding.
We know that breastfeeding is more likely to be successful and long-term if mom and baby have that time together.
Every patient that is planning on breastfeeding is going to get a visit from lactation unless they choose not to. And even if you're not breastfeeding, they can come in and help you figure out what you need to do to not be engorged if your milk tries to come in. They're there to help you during your entire inpatient stay. And then they also send you out the door with all the tools you need to contact them if you feel like you have any struggles. We're pretty protective of our little babies here at Meridian St. Luke's. We've always been a lockdown unit since our opening day. In order to get into our unit, you have to come in through one specific door and you have to be able to show that you have a direct link to the patient that you're trying to see.
Most hospitals aren't really involved in the process, and that's one of the things that I love the most about St. Luke's. They actually work on a state level to support adoption and surrogacy. We have rooms available for the intended parents, for the adoptive parents, so that they have time to become educated about a new baby, to be supported in feeding choices for that new baby. So it's, again, that family-centered care that St. Luke's is focused on, and it's huge. When a woman has a good birth experience and looks at you and says, I did it, I couldn't believe I did it, there's nothing more rewarding.
It's wonderful to see it afterward and see them tell me, I left St. Luke's feeling like I was at a boutique. I felt like I was at some kind of country club, the way they treated me, and I got care that I never thought I would get.
I wish you all the best for your birth experience. I know that it will be great, and if we get to take care of you here at Meridian St. Luke's, you're going to have an amazing day, and you're never going to forget it.